If you hear anything in the background, I am at the office and there is a train going by right now. So there's a little background noise. But I wanted to start by just saying that I hope everybody is doing well, that you did get out to enjoy some sunshine over the weekend, and that you are staying safe and healthy. And I also wanted to remind you that if you are in a position where you might want somebody to help you grab groceries or meds or other essentials, that there's a whole team of Rotarians standing at the ready and are more than happy and willing to help in any way that you know. Or if there's somebody, a neighbor or a friend or family member, let us know. We want to make sure that we can help others in the community through this COVID crisis. I wanted to tell you that in March and April, of course, we did not meet. And in April, we gave you the option of either having your meals reimbursed back to you, or if you wanted to donate those forward. And the board made a decision that we were going to support the Food Bank of Iowa. The Food Bank of Iowa serves 55 counties, including Story County. And this is where our local, smaller food pantries are able to access food at a reduced price. So when they purchase food from the Food Bank of Iowa, it's about 16 cents per pound, which makes it a little bit, helps their donated dollars stretch further and further. Why is this important that we fund, that we help support the Food Bank of Iowa? Because not only do they provide those food to our food pantries at a reduced rate, but our 6 school food pantries in Story County receive food from the food from the food bank at no cost to them. So we really are bringing more food to the community. Wearing my United Way hat, of course, we're seeing our 22 food pantries we did see a lull at one point. You'll hear a little bit about that more from Kristin, but there is a need out there still. So without further ado, drum roll please. The meals that were, the total dollars in meals that were collected, $5,446.16. Your board decided to match that, or had agreed to match that. And so we will be sending to the Food Bank of Iowa. Actually, we'll be sending it through our district foundation for the Food Bank of Iowa, a total of $10,892.32. So just slightly shy of $11,000. Virtual clap. Good job, guys. To the right, pat somebody on the back. We are, of course, not meeting in person or collecting. We're not meeting in person this month of May, and so more to come on how those things can happen in the month of May. So I want to turn to Louie right now, and if you don't have your mic on mute, you might want to do that, but we are going to make this a traditional club meeting, and we are going to have Louie sing our welcome song.
That's right, and joining you from the South Pacific, we'll start on this note. Welcome to you from Ames
Rotary, nothing of and Gay Perry. From far off lands to the USA, we're glad that you are here today.
Come back again
whenever you're.
Join us and then we'll make it clear. Around the world you will always be welcome at Rotary.
Well done, well done. Thank you. I'm just looking at my notes. All right, well, did I just take myself off mic, off video? No? Oh, well, doesn't matter. I'm gonna turn it over to Kristin Pates. Kristin Pates is no stranger to Rotary. She is the campaign director for United Way of Story County. She has been in that role for over 11 years. I believe she's had 12 campaigns under her belt. She might need to correct me if I did that wrong. But Kristin has been a pillar in our community. She has helped us branch out into businesses that we haven't been part of before. She has helped tell the story like nobody else has before. And she is going to give us today an update on what it's like during COVID-19 from the community. She's going to share her screen, I hope successfully.
It doesn't look like I can share screen while someone else is sharing screen. So
who's sharing screen?
Override that. Karen.
Who's sharing her screen? Karen, do you know what to do?
It looks like Jim Patton maybe accidentally shared his screen.
Oh, Jim, how'd you figure that out? Jim, can you unshare your screen?
And Jim, to do that, up at the top of your share screen view, it'll just have a red box that says stop screen share. While Jim is doing that, I'll just start off that this is the first time, though not my first presentation to Rotary, but it's the first time that I can say hello to fellow Rotarians. As a new Rotary member, really pleased to be a part of your club. I had 2 meetings under my belt as a Rotary member before everything kind of happened. So really looking forward to getting back with everyone, meeting you as a fellow club member. And though I've presented to the club several times, this is the first time I've done so from my home, of course, the United Way Somerset location, and also the first time I've done so in my slippers. So we'll see if that helps me or hinders me as I go through the presentation with you all. I've got several experts on United Way here in the group, past campaign chairs, loyal volunteers, and of course, my boss, Jean Cressy. So lots of people that can join in with us. And I think we have the chat function available. So if you have questions as I'm going through my presentation, just go ahead and submit those through the chat function. I think Karen's going to watch them for me or Jean, and then they can interrupt me or we'll get back to those questions toward the end of the presentation. So without further ado, I'll go ahead and get started just by giving the biggest kudos to our healthcare community and other essential industries like our partner agencies, our municipalities, the Emergency Operations Center, Iowa State University, and the Chamber for all of the great leadership they're providing at such an uncertain time. It really is comforting to know that we have strong leadership in each of those organizations because together is how we're going to make it to the other side of this, whether that happens in the short-term future or the recovery for long into the future. United Way's superpower as one of those leaders and partners, of course, is connecting the community. And that's whether the relationships are with our partner agencies, other community organizations, subject matter experts, donors, or volunteers. We can really be a leader within health, education, and financial stability at any point, but that's certainly amplified now during a crisis situation. So as communities across the globe face an uncertain future, we're seeing the same thing happening here in Story County in regard to human services. So for some of those folks who are reaching out for help, they were perhaps living paycheck to paycheck before this, and now are finding themselves without any income, and certainly that hinders their ability to provide for their family. And many other families have never needed help before, but because of the pandemic and crisis, they're reaching out for the first time and trying to access resources. So United Way is playing that pivotal role to connect our community amid COVID-19, and I'm very happy to be able to showcase some of those priority projects to you. Before we get to that though, I just want you to see here, if I can switch my slide, a little bit about the United Way network. So United Ways are in operation across the globe, and United Ways were really built for this type of work. We were born out of a challenging time where people from rural communities were starting to move into urban centers and really creating social chaos because of that. So the United Way network started actually in Denver, Colorado, and then grew after that model worked so well, grew throughout the United States and Canada, and then across the globe. So the network then extends to all of the countries that you see highlighted on the slide now. But really, it creates a powerful network, not only because we can learn from one another, but because we're all our own independent 501c3 organizations. So we can be very nimble in responding to local community needs. And again, that's true no matter what time we're in, but we're seeing it, of course, true right now. So in a time where nothing really looks the same, these local issues across the board have been amplified. And there's certainly people who are experiencing the very serious health impacts of COVID-19, either for themselves or loved ones. And our thoughts go out to those individuals, their loved ones again, and their care teams during what's a very scary time. But we also know that scary time extends past the direct health impacts to economic, social, and educational issues as well. So you would be expecting United Way to step up in a leadership role in those areas, and we certainly are doing so. So we're working to convene partners and lead conversations in different priority areas where it makes sense for United Way to be that driver. But then we're also being a supporting role for many other projects, along with Emergency Operations Center and various needs, so that we are there, whether we're in the driver's seat or the passenger seat. United Way of Story County is advocating for the vulnerable among us and for those families who are reaching out and needing help for the very first time. And some of that help can be seen when we look at the calls to 211. 211 is a national call center where you actually are going to get connected to a local person who can help you investigate resources for human services. 211 is hosted locally by Iowa State University Extension, and certainly United Way and other partner agencies encourage people to call 211 as a vast database of information. So looking at March 2019, we had 48 calls to 211. That same 4-week period in 2020, over 600 calls to 211. So that's an increase of around 1,200% locally. On the national level, there's fielding about 75,000 calls a day to 211 call centers, and that's up about 2.5 times their normal volume. So just as a side note, in 2019, of course, we know there weren't only 48 families that need help. We know there's not only 637 families that need help right now, but it can show you just a process of where people are navigating for their first call into services. So definitely that big jump will show us that there's a lot of people who haven't needed help before, don't know where to start, but know to go to 211. And then we also have had over 4,100 hits at our website, where we're hosting a resource page that I'll refer to often and give you the link at the end of my presentation as well. So United Way is working quickly on the types of things these callers need, and the stories are absolutely shattering to hear. We know of a family of 4, and this type of thing can be repeated time and time again, but a family of 4 where both parents are working in the service industry, 2 adults with teenage kids. They've had their hours reduced to 0 since March 19th, and so they've quickly eaten away at any savings they've been able to put away, and still have that huge surmounting backlog of expenses. And so United Way Services were able to help that family. But again, those stories could be repeated time and time again. Some of the priority projects that we're working on is really what I want to highlight with you all today. And before I get started, I'll give a quick side note that this is the information that I know to be true currently. And the situation, as you well know, is ever changing, and so there will definitely be subsequent changes in contingency plans or service delivery in each of these different areas. But starting at the top there with our resources, when things started to really affect Story County here in the middle of March, we worked quickly to get information out to our partner agencies so that we could understand how their services were changing and then post those on our website. That website has grown tenfold from then to now on different services that are available to our local community, including food, mental health, hunger resources, of course. So rent and utility assistance as well. It just continues to grow, I think, every day. The United Way team meets every morning to assess our response projects and then post more information on that website or talk about the community convener role that we need to play within these different areas. Another thing on resources was then pushing out resources to our partner agencies regarding the CARES Act for nonprofits specifically, so that they could better understand and have those tools available to them to see how the CARES Act might impact their businesses and provide some resources for them as well. So now I'm going to start going counterclockwise, starting with childcare. Karen Kiel-Rosser is a former board chair for us, a vice president at Mary Greeley Medical Center. And so again, in mid-March, Karen and the healthcare community reached out to us to ask a simple question. And that simple question is very complicated, but it's how can we make sure that our essential employees have access to childcare? So we went through a process of bringing together our partner agencies, also working closely with the requirements at DHS to put together plans 1 through 39 on how this could look. And we had a really great plan put together, and then the governor said no more than 10 people in one shared space. So then we started back at 0, just to give you the type of response rate that was happening and when this all started. It sounds like those, or it feels like those mandates were a long, long time ago, but it wasn't that long ago, and these projects were really pivotal at that point. So now we do have childcare, a childcare plan put together for essential employees, and worked really closely with the Emergency Operations Center to send that information out to essential employees through tiers 1 through 3. What we know is from the healthcare community alone, the first survey of how many children we would be talking about here is around 300. Now, we don't expect the need would get that high, but those were the numbers we were trying to consider when starting these plans. We do know that our solution for childcare has been accessed by, again, those tiers 1, 2, and 3 of essential employees for Story County. And there has been at least one family who has found childcare through this process, and then many more who have investigated this as a backup if they would need this, just so they can continue with their essential service into the future. The next project that I'd highlight here is immigration. So working with St. Cecilia's, we were a community convener and really trying to think about ways to provide for this vulnerable population in a time where they might not be able to access other resources. St. Cecilia is actually hosting a fund, which has great donations right now, but the need is far greater. And that fund has granted support to over 65 households. So United Way's role in this was working through what types of information is appropriate to ask as far as a human service side of things. And then also how can we connect that population to our other partner agencies, so that way we can maximize support to families in need while also eliminating or decreasing duplicating of services, duplicating of paperwork for this fund as well. So it's up and running right now. And again, a lot of this population is working in the service or hospitality industry, so they're seeing their incomes go to 0 for a pretty extended amount of time here, as we know. Our next priority project then was with shelter, working with our homelessness prevention programs and making sure those individuals and organizations aren't without support. So certainly that would be Emergency Residence Project, Access, and YSS's Rosedale Shelter. Again, bringing in Emergency Operations Center and supporting them in the ways that we can. We now have a process in place for what would happen if a homeless individual would be tested positive with COVID-19 or coronavirus, and where they could quarantine safely, so that way the spread of the virus is more contained. Our next priority project seems a little bit lighter in nature, and that's books. But what we know is that out-of-school learning is an issue for many families through the summer. So when you think about virtual learning or out-of-school learning, at this point when school has been physically closed for an extended amount of time, it really showcases the need for placing an importance on a learning enriched environment. So we're working with the Ames Public Library and the Ames Community School District to hand out books on Wednesdays at the grab and go meal sites. Some of the Rotarians on the call might actually be those that are helping to safely distribute books. So thank you for your volunteerism in this effort. We're getting a really great response from families. In fact, one parent was so excited that they reached out with some feedback saying, my sons are so grateful. This morning when we woke up, he ran to me and said, it's Wednesday, it's book day. And so you can see that it's more than just handing off that book. It's handing off that love of reading and that love of learning, which is absolutely vital right now. Some state metrics will show us that around 50% of households are not accessing virtual learning right now. And that's despite the great work that our school districts have done to try to make access as equitable as possible. It's just an uphill battle right now, and we're looking forward to the summer to think, how can we connect with more students in safe ways, and how then when the fall happens, what kind of summer slide has been again amplified because of that extended out of school learning time. In financial stability, on that website that I mentioned earlier, we are publicizing resources for filing for unemployment. We've moved our Women United financial mentoring completely virtual, and also are encouraging people to pay what they can when they can, so they're not digging a big hole that they can't get themselves out of. Whenever the sun comes out tomorrow and that the moratorium on eviction increases or is lifted, we don't want people to come up with a balance that is just insurmountable and would really put them at risk for eviction or service disruption. And then finally, in hunger, we want to support our districts as they got up and running with their grab and go meal sites. We know that student hunger is a major issue across Story County. And so we were very happy to see partners coming together right away to be able to put these grab and go meal sites up. And just to show you the number of meals and some of that number of people needing help, there were 22,000 meals distributed by grab and go sites throughout Story County. And that's just from March 23rd to March 31st. 22,000 meals in 8 days were distributed at grab and go meal sites. We're working with those school-based pantries, as Jean mentioned during her opening. There's 6 of them. We're working on the school-based pantries to make sure that they have support from us, because the numbers at first were through the roof at our school pantries as far as visitorship. At the same time, we saw at the beginning of the pandemic hitting here locally, we saw our community-based pantries actually have decreased visitorship due to our pantries pivoting and giving more food during one visit so that they could reduce the amount of times that people were coming in. And then also now, though, we're seeing those numbers spike just like our school-based pantries. So we really have need to respond to the immediate need of hunger while we're also looking at long-term recovery efforts. Iowa State University started a new food pantry and that's open now to ISU students. And on the first day, which was last week, that they opened, there were more than 150 people coming through their doors. So just a really intense need on the food side of things. Typically at this point in the year, we would be hosting our Live United food drive, but we went completely virtual with that. So that way we can, and we moved it earlier so we can support that increased need and then get help to our pantries safely, because people want to help, but how can they do that in a safe manner? Each of these different priority projects comes with increased cost, either because of increased need or higher cost associated with operating services safely. So to respond, United Way of Story County has put together our emergency community fund, and that's going to be used for the long-term recovery as well as immediate response. So far, that fund has been just selected by many donors and has just over $39,000 of support currently. What we also know is that the agencies who are helping with rent, utilities, unemployment, those sorts of things, their requests would completely deplete that fund nearly at this point. And that's just the emergency response, not the long-term recovery. So we know we're going to continue to push that fund and really try to grow it. In addition, we have Giving Tuesday happening tomorrow. Giving Tuesday is usually something that happens right after Thanksgiving, but all nonprofits are coming together to host a second Giving Tuesday, and that will be happening tomorrow. Our Live United food drive, as I said, went completely virtual, and right now we have over $24,000 in support to that Live United food drive that will be extended out to food pantries across Story County. And right now we've pushed roughly half of that out to food pantries for their first wave of need. And now we're going to be able to respond with a second wave of support now that their visitorship is increasing again. In addition to these things, we're really looking at our business at United Way and thinking, how can we connect the dots, especially for that emergency community fund? So we have unfortunately had to cancel our summer golf event, which extends help to children and youth services in Story County, but we're still asking our golf sponsors to come along with us and support that emergency community fund. And we're really proud that one of our event sponsors, longtime event sponsors, at the headline level 3M is going to continue their support so that we'll be able to, again, grow that emergency community fund, because we know the need will be great both right now and 2 weeks in the future, 4 weeks in the future, 3 months, a year into the future as well. So our ask of Rotarians then is what we come out and ask every year, and that's to give, advocate, and volunteer. On the side of giving, just really encourage you to support any cause that is close to your heart. I've of course highlighted some United Way ones, but there's just a huge level of need, and anything you can do will definitely make a difference. And I normally don't include this on a charitable line, but also shop local when you can, whenever you can, and support those businesses and chamber members who are trying to respond to their change in service and then also reopening as well. Advocating for community supports that help the vulnerable among us is going to be essential. And an easy way to take your advocacy into action is going to be following United Way on social media. When you like, comment, and share our posts, more people see that impression, if you will, and could come along with you with a gift or help us reach people who don't even know where to start to look for services because they haven't found themselves in this position before. And then finally, with volunteering, either by making masks for the healthcare community or our partner agencies who also need those PPE items, handing out books using safe social distance practices, and then calling to check on neighbors. There's a lot of things that you can do to volunteer, even here virtually, without having that face-to-face contact, that will make a big difference in the response and recovery for human services here in Story County. And you guys are doing a lot of that already. I know you were one of the first organizations to reach out and say, we have people that want to help. How can you help us connect those with the needs? So thank you to Karen and other leadership within the club that we got that up and running. And then also we're extending that to other service organizations as well. So thanks for you guys setting that bar high. Finally, then the website that I've mentioned so many times through this presentation, uwstory.org/COVID-19 resources. We are updating this on a daily basis, and it really is a one-stop shop for how to learn about the different human service supports that are available locally, whether that's mental health supports, food resources, partner agencies changing their programming. All of it is on that website. And if you are a graphics person, this website might make your eyes hurt because it has walls and walls and walls of text. And that's done with intention because we want people to not have to hunt around for the resources at a time that is very stressful for them. We also have our donation link available at the bottom of that. So again, if you're a graphics person, you're going to be scrolling past a lot of different areas of help before you see that. But as Jean said many times during our staff meeting, that's done with intention because we want people to see the large number of needs out there before they commit to sending a gift. And we want them to see all the different pieces that we're touching as well. So before I close out my formal presentation and field some of your questions, hopefully it looks like we've got plenty of time there, but I just want to thank again the essential workers, including our healthcare community, our partner agencies, all of the things that the Chamber is doing to support businesses locally, Iowa State, municipalities, and of course the Emergency Operations Center as well. We know that continuing United Way's work, especially in those areas of health, education, and financial stability, they were really important before this happened, and they're going to be absolutely vital to the long-term recovery of Story County. So I think I'll go ahead and stop my screen share, if that's okay, if everyone's got this jotted down there, and then open up for questions.
All right, I haven't seen any questions come up in the chat, but I want to echo what Kristin said about how wonderful the Rotarians are, that they stepped up early on and said yes to helping one another, and then branching out and doing things such as distributing the books. So that's all been really, really positive. Any questions of anybody? If you want to raise your hand, if you want to talk, if you don't want to type. And I can only see one sheet of names to begin with. Kristin, believe it or not, I think you left them speechless.
Well, that's good. I've said before that when I don't have questions, I never know if I did a really good job or if people were kind of multitasking and maybe tuning in and out. I think a common question that comes when we're talking to people in smaller groups then is, what does this mean for the United Way campaign 2020 and beyond? So if you're curious about that, I could comment a little bit. And it's basically, you know, we've known that these services that United Way helps us support are completely essential and needed. And our message is much the same. We need everyone in the community that can share some of their gifts to support us, because that work is needed now more than ever. So Steve Goodhue, our campaign chair for 2020, is working on some of that messaging now of how do we inspire another 5,000 donors to come along with us for another year, because the needs are still there, and United Way wants to be at the cutting edge of meeting all of those needs that we can.
I think Jeff Johnson had a question if he wants to unmute his mic. Jeff, did you have a question? Nope, just giving you a high five. So it looks like we're getting pretty good at this Zoom thing. Chad, I want to have you get off mic for just a quick minute if you could, and tell us what our program is next week.
Yeah, next week will be the Chamber. So Dan Colhane and Andrea Hammis Dodge will be talking about the Chamber's response to COVID-19 and give an update on that.
Okay. In addition to the Chamber being on board, we're going to be joined by our District 6000 Governor, Erin Moraine, and she is going to give us just about 10 minutes of a quick note and an update about what's happening in the District 6000. This is definitely not the way I thought the year would start winding down for me. But it has, and I'll have lots of time to say this to you all, but it's been a pleasure being at the lectern when I am at the lectern. I know you joke with me about all of my common mistakes that I make, forget to sing and all those kinds of things, but I just wanted to let you know that it's been a real honor for me, and I hope to see you again, other than on screen time, face to face in real time, back at the Gateway Hotel and Conference Center soon. I don't know when that will be, but as we move forward, we're getting really good at this. Oh, we do have one chat. Hang on. Oh, never mind. My quote for today is, we cannot live only for ourselves. 1,000 fibers connect us to our fellow man. This was Herman Melville, long before we use different pronouns, but I think it is definitely fitting for our community today. United Way of Story County is one of those partners among many in Story County and in Ames, Iowa, that make it so wonderful to live, work, and play here in the community. And I've said it before, if I had to be going through a crisis with anybody, this is a great team to go through it with, all my fellow Rotarians as well as the community partners. So on that note, thank you all. Stay safe. Reach out to Karen if you need anything, because we're here to help you. And I hope you have a wonderful day and that the sun will come out at least tomorrow.